Welcome to Doctors on Call. I'm Jenna Miller. Home health care is a wide range of healthcare services that can be given in your home for an illness or injury. Home health care is usually less expensive, more convenient, and just as effective as care you get in a hospital or skilled nursing facility. Home health care can empower patients and caregivers with a realistic knowledge and greater acceptance of the various diseases and conditions most important to them. Most families are unprepared for the drastic changes in their life brought on by various diseases and conditions. Alzheimer's and other dementias will cost the nation $277 billion by 2050. Research shows that elderly adults recover faster with fewer complications at home than in a hospital. With home health care, patients can get help managing their medications. This prevents harmful drug interactions, which can help you avoid going to the hospital. Home health care can help you get better and regain your independence. Home health care is our topic tonight on Doctors on Call with our guest, Tyler Dougherty with Angels Home Health Care, and also Clare Coleman.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.
Tyler Dougherty is the account executive for Angels Care Home Health located in Russell, Kansas. At Angels Care, he works with local senior centers, independent and assisted living facilities, physician offices, hospitals, and other community partners to coordinate services and education that Angels Care can provide for their residents and patients. Tyler grew up in Lucas and after graduating moved to Hayes. He has been surrounded his entire life by a family who have held careers in home health as well as pharmaceutical and medical sales, which inspired him to pursue a career in medical sales. Tyler enjoys working at Angels Care Home Health because he is in a position that helps a wide variety of patients get the help they need at home. Clare Coleman has been with Angels Care for 7 years and is the Director of Business Operations for Angels Care in Russell and Waukene. Give us a call at 800-337-4788 toll free with your medical questions about home health care today on Doctors on Call. Doctors on Call brings you information which may be useful to you when you see your own physician or healthcare provider. Thank you both so much for coming and visiting with us tonight. Let's get started with some questions. First of all, what is home health care and why is it important?
It's very important for patients to regain strength, well-being in their home. Home health is skilled nursing services, can be also addition to therapy in their home, including that of social services.
And who is eligible for home health care?
Really anybody with a skilled need in their home or therapy. If they've just had hip surgery or anything like that, they can get on our services if their insurance accepts home health. So there's a lot of good things that we can offer for them too with the skilled needs in their home while they're at home.
Sure, and are doctor's orders needed in order to start home care?
Yes, they have to be by a covering, what we call a primary care physician. They have to be seen by that primary care physician, and then that ordering provider gives us the orders that we need in order to admit them on services. We work with that doctor while the patient is on services with us. We are constantly communicating to them on what we're seeing within the home. I like to tell people that what a doctor sees in a physician's clinic is different than what we may see within a home. So they have to have a covering provider.
Okay, if a person is not sure whether they would benefit from home health care, what might you tell them?
They can do one of two things. They can reach out to their PCP, their primary care physician, or they can contact us at Angels Care. Absolutely. They can contact and talk to myself or Tyler, and we can assist them. We get quite a few phone calls a day, so absolutely.
And what happens once you make that phone call and if a person does qualify for it, then what?
So the patient has to have a skilled need in order to have services. So that skilled need might look differently. It might be a new diagnosis of diabetes or a new diagnosis of congestive heart failure, or they might have an upcoming surgery. So there has to be there has to be a medical reason that we're going into the home to care for them. They have to have a primary physician that's ordering it, and then it is 100% covered under Medicare, or what we call as private insurance. That could be VA, Blue Cross Blue Shield, some Medicare Advantage plans as well. But them three big aspects, the biggest being the skilled need. There has to be a reason for my nursing staff to go into the home to care for the patient.
Is there a difference between home health care and just home care?
Yes, definitely. So we are skilled nursing with Angels Home Health. So we are here for the patient in their home, where some of the home care is for the help with cleaning, doing dishes, helping the patient while in the home, while we're there just for the patient to do skilled nursing on them in therapy.
And what is the goal? What's the bottom line for home health care?
To keep our patients safe, happy, healthy in home, prevent hospitalizations, to get them better in their home. You know, we as we age, it's not easy. We don't want our patients to go to assisted living, long-term care. You know, we take care of wound care patients, you know, pretty extensive wound care patients, and we get them wounds healed, and they continue living a very healthy life in their home. So their happiness, their health, their well-being is first and foremost.
How often do you typically go into the home?
Usually it's intermittently, about 3 times a week we like, but it just depends on how intense it is. We do offer what kind of sets us apart from competitors and stuff. The first 14 days we are in the home more often than just to get a good feel for the patient, what are they needing at the time, just really helping them out at the first 14 days is real big. You kind of see, just to get them back going independent, build their strength back up with therapy.
I call it the start of care. It's the initial visit done by my RN in the home with the patient. Family can be present as well. At that, it's the longest visit. It's a pretty extensive head-to-toe assessment. At that visit, they determine, you know, what the patient needs. Do they need a daily visit for a week or 2? Do they need 3-time-a-week visit? It's determined on diagnosis, and it's determined on the need of the patient. So that is where it's determined. Now, patients typically are on services for what we call as an episode, so at 60-day episodes. If we determine 2 weeks in that the patient doesn't need 3 times a week, then we'll decrease it, and maybe it goes to weekly then. So every patient is truly different. So no two are the same.
Absolutely. You had mentioned, Claire, about home health care being covered by Medicare. What are some of the symptoms or needs, diseases that are recognized by Medicare to make them qualify?
Has to have the skilled need, and I keep saying that. The new diagnosis of diabetes, recent surgery, wound care, them kind of diagnoses, I would say. The other big thing for Medicare is the patient has to be considered homebound, and homebound is different for different patients. It can be that they get tired easily walking to and from their vehicle or getting out of their home. Homebound could also mean that they require an assistive device, a walker or a cane to leave the home. Or some patients, they have to require a person to leave their home. So they have to be homebound for Medicare to pay. Also, the doctor ordering. Very, very important there.
How important is it to have, you had mentioned there can be people in the home, family members, friends, whatnot. How important is it to have a support system when you're coming into the home?
Very big. I mean, that's very important to the families that, you know, growing older in your home, staying in there as long as possible, safe as possible, while having your family with you during the process, and while we can also give education to the caregivers, the family there also, while we're in there, the skilled nursing. So
I like to refer, I have been in the hospital myself. I'm not a very good patient. With that being said, when you're in a hospital setting, there's so much coming at you, and knowledge and education coming to you. So when we're in the home, it's their comfortable setting. their caregivers are present. They retain information a lot better, I would say. Caregiving, in my opinion, is vital. A lot of our patients have caregivers, some don't. So it's important. And maybe it's a neighbor that's a caregiver, maybe it's a family member that's a caregiver. So it looks differently.
Sure. We want to remind our viewers that we are talking tonight about home health care. Give us a call at 800-337-4788 if you have a question for our guest, Tyler Dougherty or Clare Coleman. Let's talk about at what point might a patient no longer be a candidate for home health care.
Okay. Safety first. If they are not safe in their home, if they are having frequent falls, if maybe they're unable to provide themselves with meals, maybe the wound care. Often when I think of that, I think of patients with dementia. Some get to a point where they start wandering from their home. So safety is key.
Sure. And what are some of the triggers for home health care?
To bring a patient on services?
Yes, absolutely.
Mm-hmm. So for Angels Care, we look at each patient individually. What is the main diagnosis? What is the main health reason that they need home health? It could be falls and weakness. It could be recent hospitalization. Maybe COVID. We've had a lot of COVID patients over the last 2 years, and we're able to provide for them in their home with active COVID. My field staff are all equipped to enter a home and to provide the care.
Sure, and I understand that every patient is different. How long might a typical session last that you come in or your RNs come in to the home to do a session with the patient?
Just on a visit?
Yeah.
So the first visit with the starter care, it usually is about 2 hours long, I would say, around there, and that's just to get everything, all the documentation done, what they're going to need. And then after that, their regular visits are about probably an hour long with each patient. Just in some, just the more intense patients, they last a little longer than that also, and some other ones just don't need too much done, just some vitals checked, and might be 30 minutes. So they kind of do vary a little bit, but probably an hour on average.
And if a patient needs something such as physical therapy, do you have therapists that come in and do that?
Absolutely.
How does that work?
At the start of care, it is determined, and maybe it's weeks down the road, that it's determined that therapy is needed. My nursing staff reaches back out to the covering provider, the covering doctor, and we tell them what we're seeing within the home. We get that order for physical therapy, or maybe they're having issues getting in and out of the shower, so then we bring in occupational therapy. Once the doctor orders it, then at each of our Angels Care offices, we have what's called a therapy coordinator. They're in charge of our therapy companies, and we get a therapist within the home within 24 to 48 hours. So we're pretty, I would say, speedy or pretty quick. Once we get the paperwork needed for a start of care for a new patient, we get them admitted within 24 to 48 hours. Same applies for therapy.
And how do you match a patient with either a therapist or an RN? How do you connect those?
So we hire our staff based on location. For example, like in Russell County, I have an RN and an LPN, and then I have a couple PRN nurses. We have a pretty great census within Russell County. So it's based off of location of patient. So for example, if we're admitting a patient in Ellsworth, that would be my RN to that area. So we try and always have like an RN and an LPN to every county. Some counties have such a great census that we have, for example, Barton County has 4 RNs that are in charge of patients down there. So.
Sure, sometimes we talk about second opinions on this show. What happens if you have a patient and maybe one of your RNs or LPNs that maybe don't connect? Do you ever do a switcheroo?
Absolutely.
In that situation?
Absolutely. We've also had to involve where 2 RNs go into a home. Maybe it's a complex wound care. So definitely available, definitely.
Explain, you've mentioned the wound care a couple of times. Explain what that is.
So, example, diabetic patient. as a person gets older, they're not as flexible as they once were. So they might have developed wounds on their lower extremities, their lower legs, where they can't bend over safely and take care of. So we do a lot of leg wraps, or what we call is lymphedema wraps. Every wound is managed differently. Our field staff are very trained for wound care. Our training process for a new employee, for example, is a 2-month process. So they don't really get to see patients on their own until after they've tested out. So our staff are highly trained.
Sure. Let's talk about some of the benefits that your patients find. We've talked a little bit about it earlier in the show, but let's talk a little more in depth about the benefit to the patients to be in home health care.
Definitely. Like I said earlier, staying in your home as long as possible. You always want to grow older in your home if possible. Even and cost effective with home care. It's a lot cheaper, especially with Medicare. It's 100% covered in your home, and you're staying in your home rather than being stuck in a hospital. And you don't have hospital bills coming, stuff like that.
You covered that very well.
Sure. Are there challenges involved when a patient lives alone rather than have maybe somebody at home to help them?
It can be difficult, yes. One of Tyler's biggest pieces of being the account executive is knowing the counties that we cover, knowing what is available. So for example, if a patient wasn't able to cook, what does that particular county offer for Meals on Wheels? Or maybe that patient isn't able to get themselves to a doctor's appointment. What's available within that county? So every Angels Care office has account executive, possibly 2, and so they have to know the area and know what's available. A lot of seniors, they don't know, and when a new diagnosis comes towards them, they kind of shut down. So that's where we come into play and provide constant education at every visit, helping them get over or mend whatever the skill is that we have them on services for.
And let's talk about how far you reach, which counties that you cover, and how far Angels Care reaches.
So Angels Care out of Russell covers 8 counties out of that office. It's kind of based off of Medicare. For example, the Russell office goes Russell County, Barton County, Ellsworth and Lincoln, then it goes all the way up north to the Nebraska border. Angels Care Waukene, they cover a lot more counties. They go down from Dodge City all the way up north to the Nebraska border, out to like almost Oakley area. So there's Angels Cares, and there's 9 here in the state of Kansas at the current point. So
excellent. Maybe one of the challenges also might be some resistance of some of your patients when you're wanting to come. Maybe they've had a family member that have been the one who has called you guys in. Let's talk about that challenge of having some resistance from the patient.
yes, a lot of seniors don't like to accept help. It's hard for them. So a lot of times we get a phone call from a provider or a doctor stating, Mrs. Smith, for example, was in and this is what is going on. They may have talked to that patient. When we make that first initial phone call, once the doctor's office has contacted us, we have all the paperwork that we need, we make an initial phone call. We introduce ourselves right over the phone, tell them who we are and what's going on. Sometimes that does happen. Sometimes it requires one of my RNs going to the home, not expecting to do the start of care, not expecting to see the patient, do the assessment, and just sitting down and explaining. Other times we've had to involve Tyler to go to the home with the family and talk to the patient and let them know that it is going to be okay, that we're here for them, that our goal is to keep them in their home. Often a misconception, I would say.
At what point does a patient check out, if you will, from the care?
So with every visit that we do, we try getting goals met, so they build points with it. Like when we go in for the start of care, we ask them, like, by the end of 60 days, your first start period, what do you want to be able to do that you can't do now? So then we work with them through education, and then if we do have to bring therapy in, and just keep working on them goals. And then every time they get scored after the visit, they chart their goal, how close they are to their goal, and then they start from there with the next visit and just keep building their way up till they get goals met. And then once they're able to meet them goals, then we are able to discharge.
And maybe we said earlier, the patient's on services for 60 days at a period of time. Maybe at the end of that 60 days the goals are not met, and maybe there's a new diagnosis that's came up, or maybe the wound isn't healed. So then we'll recertify them, keep them on for an additional 60 days. So as long as there is a skill to be in the home, we can stay in the home. If the goals are met, great, we will get out and discharge them.
Are there times when insurance won't cover home health care?
Yes, there is.
And what then?
So we of Angels Care are a little different of a home health company. So when an insurance doesn't have the home health, our corporation based out of Texas, they often will come back to us and say, okay, the patient should be trying this company. This company is covered under their particular insurance. When I started with Angels Care 7 years ago, a lot of insurances provided more. It's changed a lot. So I would say it's pretty neat that we'll go back to a patient or a doctor and tell them, you know, this is not covered by Angels Care, but it is covered by another company.
And does a patient have an opportunity to pay out of pocket, or is that not possible?
Not possible with Angels Care. If needed, we could take on a patient for charity reasons. Often comes to mind, for example, certain private insurances. You know, they have a diagnosis and it's X amount of visits that are covered under home health for the maybe entire year. So once them entire visits are used for that year, maybe it's the middle of May and they're out of home health visits. Often cancer comes to my mind. We would do a charity situation with them and continue working with the patient and the family. So.
And how long might a patient have to wait if you're trying to get through these, jump through these hoops for them? How long can it take before they actually receive the care then?
Honestly, 24 to 48 hours. Our corporation is pretty quick. It's kind of our golden rule. Once we have the paperwork to admit, it's a nurse within the home within 24 to 48. If insurance or private insurance is getting involved for that approval that we need to do the start of care, then we'll have that answer within 24 to 48 hours.
We talked earlier the difference between home care and home health care. What is the difference between home health care and hospice?
Hospice is for like the pre-palliative, I would say. Home health, our goal is to get goals met, is to work with the patient on improving and getting better. We have a program it's called Care Connections. We work with our patients, often cancer diagnosis or end-stage COPD or end-stage CHF. We work with them and their family on transitioning to hospice. For example, if it's a cancer patient, on our services they can still continue like chemo, radiation, that. On hospice, they really can't. Hospice works with the patient and the family on the diseases that progresses down prior to death.
Now, is there ever a time that a patient might get better in hospice and be able to check out and come into home health care?
Absolutely, and it happens about 2 to 3 times a month. We have a very good rapport with local hospice companies. We discharge patients to them, and then they discharge patients back to us.
Okay, how does that work? Do you have to have doctors involved with that?
Absolutely. Doctor notification, family, patient, first and foremost patient. They have to be understanding and okay with the transition. Some patients do pass on our services. They're not ready for hospice, and that's fine too. Our ultimate goal is to get them better and discharge them goals met. Sometimes that is not the case and not able to be.
So even if a patient needs maybe by the doctor's opinion to be in hospice, but they do not want to, they can stay in Angels Health Care?
Yes.
Okay. Excellent. Are there special programs for pain management?
Yes, that is one of our specialty programs that we offer that kind of separates us too. There's a lot of education. We also see a lot with with pain management, especially in the older population. They don't really talk about how much pain they actually have when they go to the doctor, and that session that the doctor gets with them, they don't get the full information that they might get. Well, with our nurses in the home, just talking to them, they learn more and more about it, and also a lot of times they see another maybe program we can get them on with depression. 85% of people with chronic pain also suffer from depression, so then we can also help them with that too, with education and therapy, especially with the pain management.
Excellent. Okay, well, we are just have a little bit of time left, so we're going to have to get this call in real quick. We've got
Okay.
John on the line from Russell. Hi, John. Go ahead with your question for our guest tonight.
Yes, I was wondering with the cancer, where the cancer and your insurance, you have to work with your private insurance. Why is it that they do not release information to the insurance company?
I guess I don't quite understand what his question is. Are you meaning like we of Angels Care haven't released information to your insurance company, sir?
No, hospice.
Hospice. He's asking for hospice.
And I was wondering why they will not release information on their visits so they can pay
The hospice,
for their service for it. Yes.
the hospice company, just like that of Angels Care, they would just need to be notified that they need to send visit information to your insurance company. We get that actually quite frequently. Insurance companies want to know what's happened within a home visit, and so we'll just send the visits straight to the insurance company.
Okay, great. Thank you guys so much for being our guests tonight on Doctors on Call. That's Tyler Deutry and Clare Coleman. On our next Doctors on Call, we'll learn how to deal with trauma with High Plains Mental Health. You can email questions to us for our next program at doctors@shptv.org. Thank you for joining us. For Doctors on Call, I'm Jenna Miller.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Hutchinson Regional Healthcare System. Our family caring for yours.
At Osborne County Memorial Hospital, our services range from clinic visits to inpatient and skilled care, but our specialty is you.
Your family is our family. The staff at Smith County Memorial Hospital wants to set the standard of excellence for healthcare in north central Kansas.
Russell Regional Hospital, experts, neighbors, friends.